One of the most common diagnoses we see is diabetes. Diabetes really starts many, many years before the diagnosis. In fact, 5 to 10 years before the diagnosis of diabetes typically, people have already started down the road that will eventually lead to diabetes. Diabetes really isn't something that just you wake up with one day and it happens to you. Diabetes is a slow process over a period of time. Diabetes is broken down into two types. Type 1 diabetes is a type that typically children get. Type 2 diabetes is what we typically mean when we talk about diabetes. That is the adult onset type of diabetes that comes from a variety of different factors. Genetics plays a role in it, and certainly lifestyle plays a role in it. Diet plays a very important role in type 2 diabetes. Certainly the American diet is very high in carbohydrates, and particularly in processed carbohydrates, pre-digested with bleach, in white flour, and in sugar. And these things predispose us to what we call peripheral insulin resistance. We have little receptors on our muscle cells called insulin receptors that act like doors that let the sugar out of the bloodstream and into the muscle cell where it's used for energy. What happens with type 2 diabetes is because sugar levels are running high and insulin levels are running high, the body downregulates the number of insulin receptors on the cell, meaning that where there used to be hundreds and hundreds of doors, now there are just a few doors to let the blood sugar out of the bloodstream and into the cell. It's like checking out at the supermarket when there aren't enough cashiers there. A line forms and sugar levels in the bloodstream increase. Diabetes damages small blood vessels. So if you think about where you have important small blood vessels, you'll understand the potential complications of diabetes. In thinking about diabetes prevention, it's very important to think about good healthy eating a lower carbohydrate diet. Also, regular exercise can reduce your risk of getting diabetes.